It's now an all too familiar fall feeling. As the temperature drops and the colors turn, COVID concerns rise. Public Health Ontario is reporting a 22% jump in outbreaks in high-risk settings, while in Quebec, more than 2,000 hospital patients have COVID, the number slowly climbing since September. No one's calling this a new wave just yet, but
there is a wave that looks like it's starting in Europe with some new variants that are emerging. There's also sort of mini waves happening in different parts of Asia.
No wonder the federal government is paying to air these reminders.
Keep your COVID-19 vaccinations up to date.
Newer bivalent vaccines are rolling out, targeting Omicron subvariants, as officials press more people to consider getting a flu shot. Influenza is set to make a nasty return this season, putting a heavier burden on a hospital system facing extreme pressure.
I've been in emergency medicine for almost 19 years now, and I have never seen the waits that our patients have to endure.
Already this week, Ontario hospitals saw more patients with COVID than in the past 5 months. In Nova Scotia, too, hospitalizations are rising again, while in BC, nurses are dealing with the impact of a protracted pandemic.
We've had people that, were avoiding going to the hospitals who are now really sick and coming to the hospital.
And consider the strain on pediatric facilities, with sick children from the Toronto area transferred to Ottawa for intensive care.
It starts with, a system well before COVID that really wasn't in a stable place.
The fear is COVID and influenza will keep rippling through hospitals, pushing more staff off work.
Canadians have better protection than in previous years with vaccination, but it's the first fall since the start of the pandemic with virtually no masks in public. Thomas Dagg, CBC News, Toronto.